Welcome to lesson 4, Origins and Insertions. By the end of this lesson, you'll be able to reinforce your understanding of muscle origins, reinforce your understanding of muscle insertions, locate the origins of major muscle groups, locate the insertions of major muscle groups. This is really an extension of lesson 3, the musculoskeletal system, so a lot of this is really going to follow on. Okay, so looking at the specific muscles. Got the vastus medialis, VMO, teardrop sometimes known as. Originates at the femur, as you can see here at the top, and it inserts into the patella. The concentric action, so the main contraction is knee extensions. I think leg extensions, squats on the way up, leg press on the way out. The eccentric action, the lengthening, is knee flexion. Next we have the vastus intermedius, still part of the quadricep group. Same origin at the femur, same origin at the insertion at the patella, but it's slightly different on the patella. As you can see, it's a little bit more medial than previously. A little bit more in the center than previously. Same actions: concentric knee extension, eccentric knee flexion. Got the rec fem, the rectus femoris. This time the origin is different. It's in the pelvis, so it's higher up, as you can see from the O, and the insertion is still into the patella. The concentric action, still knee extension, but because of its higher origin being in the hips, it also helps to create hip flexion, because the rec fem is also a hip flexor that will help the psoas and the iliacus when it comes to flexing your hip. So the opposite actions of knee extension and hip flexion are the eccentric actions of knee flexion and hip extension. Vastus lateralis. So the big muscle on the lateral aspect of the femur. It originates at the greater trochanter, that bony bit on the outside of your hip, and the femur. But it still inserts into the patella, but as you can see here, the insertion is a lot more lateral than what it was for the previous other muscles of the quadricep group. The concentric action is knee extension, and the eccentric action is knee flexion. Looking at the hamstrings now, the muscles on the back of the thigh, and there's 3 of them. First one, bicep femoris, originates in the pelvis, just off the ischium. It inserts into the fibula, the smaller bone on the lower leg. Its concentric actions are flexion of the knee, extension of the hip, and external rotation of the tibia. Eccentrically, it performs knee extension, hip flexion, and internal rotation of the tibia. So if you think a Romanian deadlift or a good morning where you've got a hip hinge, you're going to create flexion at the knee, but you're also going to create extension on the hip on the way up, and then you're going to get tibial external rotation a little bit at the same time. The next muscle in the hamstring, semimembranosus, originates in the pelvis, inserts into the tibia this time. So the concentric actions here are knee flexion, hip extension, tibial internal rotation again. So the tibial internal and external rotation really becomes prominent in things like running and walking, when you're going through the transition of your walking gait, when your foot hits the floor, goes through your mid stance and then out again into your next step. Final muscle in the hamstrings is the semitendinosus, originates in the pelvis, also inserts into the tibia. But now this is only responsible for knee flexion and hip extension, concentrically and eccentrically knee extension, hip flexion. So no responsibility when it comes to internal and external rotation of the tibia. So the difference between the three muscles is essentially semitendinosus only performs knee flexion and hip extension. Semimembranosus and bicep femoris perform knee flexion, hip extension, and rotation of the tibia. But the difference between semimembranosus and the bicep femoris is the insertion, where one is at the fibula and the other is at the tibia. Okay, moving on to the glutes. The gluteus maximus, we know, is the biggest muscle on the glute. It originates at the ilium. The ilium, remember, elephant ears when it comes to looking at the pelvis. It inserts into two places, the greater trochanter, that part on the outside of the hip again, and the femur. Concentrically, it provides hip extension, so think the up phase of a deadlift, the up phase of a squat, the outward phase of a leg press, kettlebell swing, glute kickbacks, glute bridge is all glute maximus hip extension. The glute maximus also allows for hip external rotation. The eccentric actions are hip flexion and hip internal rotation. That's really just the way back from the movement. Got the gluteus minimus. Originates at the ilium, the elephant ears again, as you can see, it's a bit more clear if you've not heard that reference before. Inserts into greater trochanter in the femur again, but the motions are different. There's no hip extension anymore. The motions available now are hip abduction and hip internal rotation. So that's to say hip external rotation. Eccentrically, you've got hip adduction and hip internal rotation. So this is useful for things like pivoting, turning, anything where you have to open your body to change direction. You're going to need decent glute minimus contraction and strength. And then finally for the glutes, we have the glute medius, the middle-sized one, which originates in the ilium, and the same insertions of the greater trochanter and the femur, but the concentric actions are hip abduction and hip external rotation, just like the glute minimus. And eccentrically, you get hip abduction and hip internal rotation. Next, we have the adductor, the adductor group. We're going to look at the adductor longus. So we know the long adductor muscle, and it originates at the pelvis and inserts into the femur, as you can very clearly see from this picture. The concentric actions available here are hip adduction, clues in the name, but also hip flexion and hip internal rotation. So the way I can kind of think of where your adductors are really important is if you've ever played football and you've tried to cross a ball in from the wing, you've had to cut across your other leg, get whipped around the ball, you're going to need a good amount of adduction, flexion and internal rotation. Eccentrically, to be able to get that good power and connection, you're going to need decent hip abduction, hip extension and hip external rotation. Got the adductor brevis, the smaller one. See, it's shorter. Originates in the pelvis, inserts into the femur, but higher up than the adductor longus. This is also responsible for hip adduction, hip flexion, and hip internal rotation. Eccentrically is the same: hip abduction, hip extension, and hip external rotation. So the eccentric actions are always just the opposite of the concentric and vice versa. Adductor magnus originates in the pelvis, inserts lower into the femur, as you can see, but it also inserts into the almost the patella. Concentrically, hip adduction, hip flexion, internal rotation. It's the same again. So the eccentric actions are the same: abduction, extension, and external rotation. Now moving still in the adductors but higher up, the pectineus originates in the pelvis and inserts into the top of the femur. Same motions: adduction, flexion, internal rotation. Same eccentric: abduction, extension, external rotation. But look at the position and the size of it compared to the previous three adductor muscles. And finally, the gracilis looks like a blade of grass. Long, thin blade of grass. Difference with this one: it originates in the pubis, inserts into the tibia, allows for adduction, flexion, internal rotation, but it also internally rotates the tibia in certain motions. Eccentrically, abduction, extension, external rotation, but obviously by the nature of opposites, it will externally rotate the tibia. Now we're going to look at the lower leg. So the tibialis anterior, as you can see here in yellow, the muscles that allow you to dorsiflex your ankle and invert your ankle. So originates in the tibia. It inserts, it actually comes across from the sort of a medial to, middle to a lateral aspect. It cuts across into the big toe, so it actually inserts into the first metatarsal. Concentrically, it allows for dorsiflexion and inversion, and eccentrically, you'll get plantar flexion and eversion. So inversion, the sole of the foot facing in; eversion, the sole of the foot facing out. Tibialis posterior originates in the tibia and the fibula. So this is one of your deeper calf muscles, opposite to tibialis anterior. The insertion is in the tarsals, the talus and the metatarsals in the foot. And its concentric actions are ankle plantar flexion and inversion. Its eccentric actions are ankle dorsiflexion and eversion. It does the opposite of the tibialis anterior. Also in the calves, we have the soleus. Look at the size of it. Covers the whole thing. So it originates, its proximal point is at the tibia and the fibula, and inserts into the calcaneus, the heel. Concentrically, it allows for ankle plantar flexion, and eccentrically allows for ankle dorsiflexion. So you can think of the soleus as the gastrocnemius's brother, if you like. They do the similar jobs. So this one also originates in the femur and inserts into the calcaneus. It allows for ankle plantar flexion and ankle dorsiflexion. Peroneus longus. Muscles in the outside of the front of your lower leg. Originates at the tibia and the fibula at the top, where the two split or divide, and inserts into the first metatarsal. So it actually comes across. You might actually have to zoom in a little bit on this one, because I know it looks like from first glance that it goes to the outside, but you can see at the bottom where that line is, it actually cuts across, and the yellow line is very faint, but you will be able to see it. The concentric actions of the peroneus longus are plantar flexion and eversion of the foot. Eccentrically, you're going to get dorsiflexion and inversion of the foot. Next, we have the TFL, the tensor fascia lata. You can see this yellow structure down the outside. It's more about this thick bit at the top rather than the IT band, which is all the way down. The origin of the TFL is at the iliac crest, so that crescent-shaped part of the pelvis outside of the ilium, and it inserts into the IT band. So it's only really this thick component at the top. The thinner component in the lighter yellow is the IT band. It's not so much a muscle. It's more a band of fascial tissue. Concentrically, you've got hip flexion, hip abduction, and hip internal rotation. Eccentrically, you've got hip extension, adduction, and internal rotation. The psoas, so key muscle in the hip, originates really high up in the T12 vertebrae and the lumbar vertebrae, and inserts into the femur. Because it's a hip flexor, you are going to get hip flexion, but you're also going to get hip external rotation, lumbar extension, and lumbar rotation. So this is a very key muscle in terms of length-tension relationship when it comes to lumbopelvic dysfunction. So sitting at a desk all day is an example, causing certain muscles to shorten, such as the psoas, and certain muscles become long and weak, such as the abdominals and the glutes. Eccentrically, you're going to have hip extension, hip internal rotation, lumbar flexion, and lumbar rotation. The sartorius also starts in the pelvis. This inserts it lower into the tibia rather than the femur, and this runs from the outside of your hip to the inside of your knee. It's often mistaken as a quad. When you look at a lot of bodybuilders who've got very striated legs, you can see this extra muscle and it almost looks like a fifth quad. And it does act similar to a quad, but it isn't actually a quadricep. So hip flexion, hip external rotation, abduction, knee flexion, and knee internal rotation, very important muscle for knee stability and hip stability and strength. Eccentrically, hip extension, hip internal rotation, hip adduction, knee extension, and knee external rotation. Then we've got the piriformis, originating in the sacrum, inserting into the greater trochanter and the femur. Concentrically, it provides external rotation, abduction, and extension of the hips. Eccentrically, you're going to get internal rotation, adduction, and hip flexion. Very important muscle that is often overlooked. So when it comes to injuries, we have something called piriformis syndrome that can feel and look a lot like sciatica, where the sciatic nerve is impinged and you're getting a numbing sensation all the way down the leg. A lot of the time, sciatica is diagnosed, but the actual thing that is happening is piriformis syndrome, and the piriformis just needs releasing. We'll cover that more in the common injuries section. Then we've got rectus abdominis. Now the I and the O look different here, but remember O is closer to the pelvis and I is further away because it's distal. So the origin here is the pubis symphysis. The insertion is ribs 5 to 7. Concentrically, we're going to get flexion of the spine, so think sit-up, abdominal curl, spinal lateral flexion, side bends, spinal rotation, Russian twist, cable rotations, wood chops. When we're so that's the unloading part of the movement. The loading part of the movement, the eccentric, is the spinal extension, the spinal lateral flexion, and the spinal rotation on the opposite side to be able to generate enough length to accelerate back through those motions. Staying around the torso, we have the external obliques. They originate in ribs 4 to 12 and they insert into the iliac crest. Concentrically, you're going to get spinal flexion, lateral flexion, rotation as well. Eccentrically, extension, lateral flexion, spinal rotation. Lateral flexion, spinal rotation on the opposite side. Internal obliques, so obliques on the inside, originate the iliac crest and the thoracolumbar fascia. They insert into ribs 9 to 12 and the linea alba. Same motions, flexion, lateral flexion, rotation. Next muscle is the transverse abdominis, or the TVA. Its role is really for stabilization. It does provide a little bit of rotation, but it's a deeper core muscle that stabilizes the trunk in movement. So you can think of this as being trained in more things like planks, things where you're having to maintain a fixed position. Really important for controlling that movement. It originates in the 7th to 12th rib, the iliac crest, and the thoracolumbar fascia, so it's got several origins. It inserts into the linea alba. Then we've got the diaphragm, key muscle for breathing. So it originates in ribs 6 to 12, and then the lumbar L1 to L3. It inserts into the central tendon of the spine, and its concentric action is to open the thoracic cavity to breathe in, and then eccentric action is to close the thoracic cavity to breathe out. So iliocostalis lumborum, as you can see here from the lower back, it originates in ribs 7 to 12 as well as the pelvis, inserts into cervical 7, ribs 1 to 6. It allows for spinal extension, spinal rotation, and spinal lateral flexion in concentric movement, and then spinal flexion, spinal rotation, and spinal lateral flexion the other way for eccentric movement. Iliocostalis thoracis. So the clues in the name here: starts at the ilium, goes to the costals, up the thoracic. So originates ribs 7 to 12, as you can see, inserts into ribs 1 to 6 and C7. It's concentrically going to give you spinal extension, rotation, and lateral flexion. Higher up, so iliocostalis cervicis. So from the ilium to the costals to the cervicis, so the cervical. Originates in ribs 3 to 6, inserts into C4 to C6. Concentric action, spinal extension, spinal rotation, and lateral flexion. Okay, we're going to look at the longissimus group now. So the longissimus thoracis translates as the long muscle along the thoracic. So it originates in the lumbar vertebrae, the sacrum and the iliac crest. and inserts into thoracic 1 and thoracic 2, thoracic 12. Concentrically, it will give you spinal extension, rotation, lateral flexion, as all the other erector spine muscles. So eccentrically, it's going to give you flexion, spinal rotation the other way, and lateral flexion the other way too. So now looking at the spinalis, we've got the spinalis thoracis, so spine, the closest to the spine that runs along the thoracic. As you can see, the origin starts at L1 to L3. Insertion is T4 to T7. Concentrically, you're still going to get rotation, extension, and lateral flexion. Eccentrically, you're going to get rotation, flexion, and lateral flexion. So spinalis cervicis, so it's closest to the spine along the cervical, originating in C6 to C7. Then you've got the insertion point at C2 to C3. Very small muscle, responsible for spinal flexion, spinal rotation, and spinal lateral flexion. So by the opposite, you have extension, rotation, and lateral flexion again. You've then got the beard-looking muscle, the reverse beard, the spinalis capitis. So the cap of the spinalis, the top of the spinalis group, originating C7 to T1 to T3, inserting in the temporal bone up at the base of the skull. Concentrically, you're going to get extension of the neck, spinal rotation of the neck, and spinal lateral flexion of the neck. Eccentrically, you're going to get spinal flexion, spinal rotation, and spinal lateral flexion. Next, we have the QL, the quadratus lumborum. It's quite a problematic muscle group for a lot of desk-based people with lower back pain. So the QL is on the outs, well, it's kind of like lateral to the erector spine, so it's not part of the erector spine itself. It starts at the pelvis and inserts into the 12th rib as well as the lower 3 lumbar, or lower 4 lumbar rather, and it's responsible for lateral flexion of the spine. So you often have problems with this if you've not been lifting with a neutral spine, or if you've been picking a lot of stuff up with one side, so carrying suitcases, reaching for things on the floor. They may cause stiffness or imbalance in your two QL muscles, causing pain on one side. So usually if it's on one side, it's going to be because of something that you've probably been doing. Okay, going back to the erector spine. We've got the transversospinalis, so transverse, rotational. It's wrapped around the spine, so it's wrapped around the spine and the vertebrae, and this is in the thoracic region. So originating at T7 to T12, inserting into C6 to T4. That allows for extension, lateral flexion, and extension and rotation of the head. So eccentrically, spinal lateral flexion, spinal flexion, and head rotation and head flexion. Transversospinalis cervicus, so the same thing, wraps around the vertebrae at the cervical. C4 to T6 is its origin, C2 to C5 is its insertion. You've got spinal lateral flexion, spinal extension, and head rotation. So a lot of people who can't turn their head, they lose function from sitting at a desk, being hunched over. You're not able to contract the transversospinalis cervicus properly, meaning you're going to get stiffness, which can lead to problems when you play sport and a lack of range of motion and a lack of function, or even may prevent you stopping, or it may prevent or stop you from doing things overhead or things that require you to use your head to drive a motion, for example, a lunge and a rotation. Transversospinalis capitis, so again the one at the top, wrapping around from C7 to T6, inserting into the skull. Same kind of principle applies. It allows for extension of the spine, lateral flexion of the spine, extension of the head, but rotation of the head as well. Okay, then we've got the multifidus, the more popular one. It runs all the way from the base of the spine to the top of the spine and overlaps all the other muscles. The lumbar, thoracic, cervical spine are all its origin points. It inserts into every vertebrae except C1. Concentrically allows you to extend the spine and rotate the spine. Eccentrically flex the spine and rotate the spine the opposite way. Moving on to more common muscle that we know the latissimus dorsi, or the lats. This big wide muscle from our shoulder down to our pelvis. It originates at T7 to T12, the iliac crest, and ribs 9 to 12. Because it's so big, it has many origin points. It inserts into the scapula and the humerus, and it allows you to perform shoulder extension, shoulder adduction, and shoulder internal rotation. Eccentrically, it allows for shoulder flexion, shoulder abduction, shoulder external rotation. Now we have the serratus anterior. We said was the boxer's muscle in the previous lesson. It originates from ribs 4 to 12. As you can see, inserts into the scapula, and it allows for scapular protraction. Eccentrically, you're going to get scapular retraction. So you're going to use your serratus to things like a chest fly, chest press, where you're having to protract your scapula, and you're going to load that through the retraction part of the lengthening phase of the movement. Now looking at the rhomboids, originating at C7 to T5, just on the inside of the scapula, inserting into the scapula. Concentrically, you're going to get retraction. Eccentrically, you're going to get protraction. The lower traps, as you can see, the trapezius, or the lower half of it, is like a V, sort of on the inside of your lats. It's going to create scapular depression concentrically and shoulder elevation eccentrically. So it works antagonistically to the upper trap, which allows you to elevate your shoulder concentrically. The middle trap, just the middle part of the trapezius group, T1 to T5 origin, scapular insertion. So remember the 17 muscles that attach to the scapula. There's a bit of a bonus point. See if you can write them down as we go out throughout all the lessons. See if you can get them. This is going to allow you to retract concentrically and protract eccentrically as well. So if you've got a rounded posture, you need to be working the middle and lower traps, strengthening them, and starting to look at stretching the upper trap and the other tight and short muscles, which we'll go into more in our corrective exercise section. The upper trap originates in the skull and inserts into the top of the scapula. Concentrically, it's going to allow you to extend your cervical, laterally flex your cervical, rotate your cervical, but also elevate your scapula. It will act as a synergist for the levator scapula, which literally translates as elevate your scapula. Eccentrically, you're going to get cervical flexion, so that's otherwise tucking your chin down towards your chest. Cervical lateral flexion, getting your ear towards your shoulder. Cervical rotation, getting your chin over your shoulder. And scapular depression is pulling your scapula down. So following on, the levator scapula, the main muscle that elevates the scapula, the upper trap will help it. You're going to get C1 to C4 origin, insertion at the scapula. You're going to get cervical extension, cervical lateral flexion, cervical rotation, and scapular elevation from this muscle in a concentric motion. Then you're going to get the opposite of that in the eccentric. Okay, moving on to the pectorals. So, pectoralis major originates in ribs 3 to 5. Very clear on this picture. Inserts into the scapula again. Concentrically, you're going to get protraction, which is why you're also working your serratus when you do most pushing movements, if not all of them. Eccentrically, you're going to get retraction. Anterior deltoid originates at the clavicle, inserts into the humerus in the arm. So not the scapula for once. Concentrically, you're going to get shoulder flexion. Think of a front raise. It's shoulder internal rotation coming across like throwing a punch. And eccentrically, you're going to get shoulder extension. So think of that as like lining up to hit a snooker ball. And shoulder external rotation, which is lining up to throw a ball. So the medial deltoid, the middle of the deltoids or the middle of the delta, originates at the scapula. So it doesn't insert into the scapula this time, it originates at the scapula. Very important distinguished difference. Inserts into the humerus. It's a bit of a flipped roll. And it allows you to abduct the shoulder. So think of a lateral raise. Eccentrically, you're going to get adduction of the shoulder. Posterior deltoid, the hardest one to hit out of the three, originates at the scapula. Again, it's not inserting into the scapula, it originates there and inserts into the humerus. Concentrically, you're going to get shoulder extension and shoulder external rotation. And eccentrically, you're going to get shoulder flexion and shoulder internal rotation. So if you're not already doing it, you want to be trying to do these movements as I say them to see what if you can understand the motion and see what it feels like, but also see what it looks like so you have a better understanding of what I'm saying. It will also reinforce your understanding of the joint motions. Now we're looking at the rotator cuff group, the teres minor. It's like a minor tear or tear. Originates at the scapula, inserts into the humerus. Concentrically, you get shoulder external rotation. Eccentrically, you're going to get internal rotation. Infraspinatus, so inferior to the spine of the scapula, underneath. So its origin is underneath. Call it the inferior border of the scapula. Inserts into the humerus, but the top of the humerus near the shoulder. Allows for external rotation as well. Eccentrically, you're going to get internal rotation. Then we've got the supraspinatus, so above the spine of the scapula, so superior, meaning above, originates in the scapula, inserts into the humerus again, concentrically abducts the arm, eccentrically adducts the arm. And then you've got the subscapularis that originates at the scapula, inserts into the humerus. It allows for internal rotation of the shoulder and the concentric, so it works antagonistically to the infraspinatus and the teres minor, and eccentrically is going to provide external rotation. Then you've got the teres major, which it just isn't actually part of the rotator cuff group. It originates at the scapula and it inserts into the humerus. Quite an important muscle. It allows you to internally rotate your shoulder, adduct your shoulder, and extend your shoulder. But remember, it's not part of the true rotator cuff group. Eccentrically, you're going to get external rotation, abduction, and shoulder flexion. Okay, then we've going just to finish off with a couple of neck muscles. So we've got the sternocleidomastoid, the SCM. Remember, it connects the sternum to the clavicle to the mastoid. The mastoid is the mastication is chewing, so it's going to be your jaw. Originates in the sternum and the clavicle, inserts into the skull. Concentrically, you're going to get flexion, lateral flexion, and cervical rotation. Eccentrically, you're going to get extension, lateral flexion, cervical rotation the other way. Then we've got the scalenes, originate in C3 to C7, insert in ribs 1 to 2. Allows for cervical flexion, cervical rotation, elevation of the ribs. Slightly different role or an extra role involved there. Eccentrically, you're going to get extension of the cervical rotation the opposite way. And if you're going to get elevation of the ribs concentrically, you're going to get depression of the ribs eccentrically. So if this muscle gets tight, it can compress your breathing. Okay, so I appreciate that was a lot to take in, and it was a little bit repetitive, but it's worth going over this a few times. If you really know your origins and insertions, and you know your muscles to a good standard, it will help you to create great movements, great programs for your clients, and then work around their areas of pain and dysfunction as well. So, learning check for this lesson. Number one, what is the definition of an origin? Number two, what is the definition of an insertion? 3. Where is the insertion of the pectoralis major? Feel free to go back if you're not sure. Question 4. Where is the insertion of the vastus lateralis? Question 5. Where is the insertion of the soleus? Number 6. Where is the origin of the teres major? Number 7. Where is the origin of the rectus abdominis? Question 8. Where is the origin of the semimembranosus? Number 9. What is the concentric action of the supraspinatus? Question 10. What are the concentric actions of the anterior deltoid? Again, you want to be scoring 7 or above to show that you're on track for passing your exams. If you can get yourself to a 9 or a 10, this is going to really give you a good solid chance of understanding the rest of the lessons. I highly recommend that if you do feel like you need more time with this, to use other resources like Essential Anatomy 5 and using wall charts to help you, because this is really going to help you to understand the rest of the lesson. Quiz answers for this lesson are as follows. So the answer to number 1 is the proximal attachment is where a muscle begins. Number 2, the distal attachment where a muscle ends is the insertion. Number 3, the answer is scapula. Number 4, patella. Number 5, calcaneus. Question 6 is the scapula again. Number 7, the pubis symphysis. Number 8, the answer is the pelvis. Number 9, the answer is abduction, abduction. And 10, the motions are flexion and internal rotation. To finish off this lesson, we're going to recap the objectives from the beginning. Are you now able to reinforce your understanding of muscle origins? So hopefully you've built upon your level 2 knowledge. Point 2 is be able to reinforce your understanding of muscle insertions. Number 3, locate the origins of major muscle groups. And last but not least, are you now able to locate the insertions of major muscle groups? Okay, so that's the end of this lesson on origins and insertions. I hope you found it useful. I hope you've enjoyed it. Good luck with the rest of your revision for this topic, and I look forward to seeing you for the next lesson.